Welcome to God's Love for the Unlovable. This is my second interview with the nationally renowned counselor and neurofeedback expert, Shari Johansson. In the first show, we talked about the benefits of neurofeedback, everything you need to know. In this show, we're going to focus in on the massive problem of long COVID. If you haven't heard about long COVID, you will, particularly if you or someone you love had one of the first strains of COVID-19, Alpha or Delta. Symptoms? It's a long list. It's fatigue, shortness of breath, difficulty thinking, brain fog, sleep problems, pins and needle feeling in your extremities, changes in taste and smell, diarrhea or constipation, diabetes. 26 million people in the United States have it. Many can't work anymore, some of them quite young. But there is something that you can do, and it would include neurofeedback. I think you'll enjoy hearing from Shari. So welcome to God's Love for the Unlovable. Hey, welcome back to Gospel Rant and God's Love for the Unlovable. I'm Dr. Bill Sinyard. I'm here again with Shari Johansson. We just finished a video. You can track it down on neurofeedback. I recommend it to you. So, Shari, we're going to be talking about long COVID today. Very important. Shari is the owner and clinical director of Grey Matters, Grey, Grey Matters Neurofeedback and Counseling in Denver. Grey Matters provides a holistic approach to mental, spiritual, and overall well-being through counseling, neuromodulation, neurofeedback, training, mentoring, internships, QEEG analysis, among other things. Among her many credentials, LPC and QEEG D. She's a recognized national leader in growing neurofeedback field, but also now in long COVID. She's going to be presenting a paper. Hopefully she'll tell us about that in June. During the pandemic, and this is what we're going to be narrowing in on today, Shari began working with clients with cognitive and autonomic nervous system dysregulation due to COVID-19, long-term systemic effects, which we now call long COVID for short. After 15 months of working with clients in this area, in December 2021, she contracted the dreaded Delta variant, and she'll tell us why that's important, of COVID and COVID pneumonia. She ended up hospitalized. Her O2 readings were down in the 70 percentage. Wow. She had difficulty breathing, vascular issues, fatigue, neuropathy, COVID onset diabetes, and general brain fog. She's on the mend, thank God, and hopefully she can help you identify if you're struggling with stuff. If somebody sent this video to you, maybe this could be your salvation. So, and a little bit of COVID. This is CDC numbers that I checked. She's got the newest and latest numbers, but this is the conservative CDC. 1 out of 5 people who had COVID-19 have long COVID. That's 1 out of 13 of the entire general U.S. population. That's 26 million people. That's ridiculous. That's a major health issue in the United States and in the world. What I've found is less likely for older adults, so less likely for people like me, over 65s, twice as likely for women than men, and the Hispanic community is the worst hit at 9%. I also want to say, as I said in my last video, David, her husband, and Shari, and I and my wife, Eunice, we are good friends, and I am such a big fan. So, Shari, welcome again to God's Love for the Unlovable and the Gospel Rant.
I'm thrilled to be here, Bill.
So, COVID, long COVID. Can you put it in lay terms what it is? I mean, I heard on the news that we're over COVID.
Well, I think the Omicron version, which started basically January of 2022, is a milder, more virulent, but milder version of COVID-19.
Yeah, I think I had that one. Mm-hmm.
Yeah, and so people are still getting sick, but it's not that different than a bad flu, cold, respiratory infection. Some people feel it more in their gut than in their lungs. But it's very different than those first very deadly versions of Alpha and Delta variant. Those, that's where we were seeing on the news, the deaths and people that were just deathly ill. Yes, I was unfortunate enough to contract the Delta variant about 2 weeks before it was no longer a thing.
Oh, no.
So, so the timing is something else. But I was working with COVID long COVID sufferers before I got ill. We were getting referrals from National Jewish and a couple of other places around that had heard that neurofeedback was beneficial, especially for the autonomic nervous system dysregulation called POTS, postural orthostatic tachycardia, where you stand up and you feel like you're going to faint, your heart's racing and all those things, as well as all the cognitive effects. So slowed memory recall, brain fog, mental fatigue. I can't read a book anymore, without just feeling very fatigued. Yes, I'm speaking on this at AAPB, which is our Applied Physiology Conference for biofeedback and neurofeedback in June, coming up
on
in a couple
long
weeks.
COVID particularly.
On long COVID in particular, and the interventions that our practice has found most helpful. And it's varied in the sense of it's not just neurofeedback, but neurofeedback is a key component for all of the neurologic symptoms. So knowing those things when I got sick was very helpful to me. I knew to watch my SpO2, so you can buy one for 25, a little finger
Percentage
monitor.
oxygen level.
Yep. Basically I got sick. Normal flu kind of stuff. Dave was sick at the same time. It was the guy working on our bathrooms, our tile guy, here we are in November, after Thanksgiving, and we come home from work and he wants to show us something, and we're standing in the bathroom. It's cold in Colorado in November, and the dude's sweating, and I'm like, oh no. So I still didn't know that he had COVID at that time, but like 2 days later, we were both down. Trapped in a small bathroom with a dude who's obviously very ill. And so that's how I contracted it. I know exactly where and when, because we had remained open during COVID, taking all precautions, and nobody in my office ever got sick. So, and I feel like that was just very lucky. And so I knew all these things. So yes, when I got sick, it didn't feel like a horrible version of COVID, but I was doing all the things. Trying to take care of myself, and I was monitoring my oxygen levels. When my oxygen levels, started rapidly dropping from the 90s to the 80s to the 70s within a 24-hour period,
I
knew I was in trouble. Because I had already, I'd been sick about a week. I actually felt better, and you know how you were driving by everything and they would load your car with whatever you ordered? Well, we had gone to the tile store, so I was feeling good enough to get out and go pick up my tile. And then that weekend, over Thanksgiving, is when I just plummeted. And it was really that I got more fatigue and my oxygen was dropping. So we went to the ER, and they, of course, shipped me off in an ambulance to the hospital. So oxygen is what I needed. And I still stayed, I was in the hospital a full week. And people need to know that's $100,000 bill these days. But, I'm grateful for the oxygen. I'm grateful that for whatever reason, it just wasn't my time to go. But then we move into, I had the Delta variant, which causes the most neurological problems. Second, I think, is the Alpha. But what happens is a spike protein that is the coronavirus, the COVID-19 virus, passes the blood-brain barrier through the trigeminal nerve, but also just, we used to think that the blood-brain barrier was like this rock solid, kind of like, the borders between countries. And it's porous.
Another topic for another day.
Another topic for another day. But it's porous and different levels of porousness in different people. So, we don't know all the reasons that some people are more susceptible to long COVID, or the fact that it causes neurologic damage. It often looks like a head injury in an EEG because it causes slowing. Now that could be vascular slowing, because it affects the vascular system, causing plaques on the arteries. It
Causing
can cause,
plaque.
yes, yes, because the plaques are an immune effect for the vascular system.
To protect it.
And so, yes, it causes that. It causes what's called vascular ischemia, less blood flow to the brain. And so, COVID can affect any organ. It affects the vascular system. It can damage mitochondria. It affects the neurons, the astrocytes, the glia, and the neurons in the brain. And so it depends on, what type of COVID that you had, your likelihood to get long COVID. You were quoting CDC stats. Basically, 20% of people in different countries, especially when we were just looking at data before 2022, it was more like 40 or 50%. But you have to remember that those were the first two variants. And so what
Right.
CDC is tracking is all the variants for the last 3 years.
Okay.
And so, what we're finding in our clinic is that, if you had one of those first variants, you're more likely to have long COVID, and people aren't connecting it because they get over COVID
Yep.
and they feel better, but they don't ever return to the same energy level or the same cognitive level. Sometimes respiratory illness, sometimes dizziness, sometimes those autonomic nervous system, they don't sleep as well. They don't get as much oxygen because of a central nervous system problem. So
You mentioned, I
people,
think, or somebody mentioned the pins and needle kind of effect
yep,
in your extremities, right?
yes, and that can
Diarrhea, but
be,
also constipation. I mean, it's kind of like could be anything for anybody.
that's right. There are over 300 symptoms
Oh my
um,
gosh.
listed by the CDC for long COVID. I talk about 200 of those.
Oh,
Um,
just trimmed it
but
down to.
we don't have time to talk about all of those. But when you have microclotting, you can get gangrene, you can get other problems. Most people aren't talking
Gangrene.
about the fact that COVID not only causes heart disease, and they're now saying it's a precursor to dementia because it slows down the brain. It looks like a head
Well, that makes
injury to the
sense.
brain.
Yeah.
But also the other organs and even the peripheral nervous system that gets neuropathy. Microclotting can cause, and this can come from the vaccine as well. It doesn't matter how you get the spike protein. What matters is how does your body deal with the spike protein. And the spike protein causes an inflammatory cascade that then is mimicked by the immune system to replicate spike protein and spread it as part of your immune defense. But then we have this chronic inflammatory response going on that can last for months and months. They've found spike protein, up to a year and a half later in people. So what's interesting to me is if you didn't have severe COVID, people aren't even connecting their long COVID symptoms with their bout of COVID because they tend to get worse over the 2 or 3 months after COVID. And so they're not necessarily saying this is long COVID. So that's been an interesting thing. Now, I've known about long COVID, I mean, even before I had it. And so I'm helping people connect the dots. I'm like, now one of our questionnaires is, when did you have COVID?
Yep.
Because if it was one of those first two variants, then a lot of your symptoms that you're coming to us for are likely due to the spike protein's damage in your system.
So I imagine we've got lots of people, listeners, freaking out right now because I mean it's everything, right? It's everything from the common cold to diabetes symptoms to inflammation. Inflammation that's could be anything.
Right.
So what do they do? I mean, they're already scared. We've gone through 3 years of just fear and anxiety. Help.
Don't Well, now my functional doctor and other people's functional doctor are specializing in long COVID because there are so many millions of people affected. But most medical doctors don't know what to do.
Yeah.
They don't know what to do for you. And I would say even a year ago, they were kind of making you think it was a psychological problem because they couldn't pinpoint, if you come in with 10 symptoms, they think that you've got a mental disorder, not that you actually are having physiological problems.
Right. This is physiological.
It's physiological, and we can see it in the EEG. We can also, I'm lucky enough to have Dr. Michael Pierce, who does some of our neurologic exams for us. He can test for neuropathies and neurologic damage.
So back to the EEG. You can, if you put the netting thing on somebody, they sit them down in this comfortable chair and watch a video, you could determine within an hour whether this is long COVID?
What we can determine is what their brain function is. If they have vascular ischemia, think about, your arteries coming up from your heart through your neck to the back of your head, and then they spread out through the brain. Yep. So if we see vascular slowing in a 30-year-old or a 19-year-old, if we see vascular slowing, that is not from old age and bad diet. That's likely from COVID because it's not normal. We haven't ever seen this vascular ischemia in young people before. And this is across all neurofeedback people. So neurofeedback is worldwide. I know most people haven't heard of it, but in Denver, because we're so into alternative medicine, we have a high number, probably 100 providers in the Denver metro area.
Wow.
I think Dallas is close to that. So it feels new, even though it's been around since the 60s.
So within a single setting, a session,
yes,
you could basically say there's signs there that you might have. Here's another questionnaire. We can find it where it's actually beating you up.
Yes, when we do the what's called the EEG recording, the quantitative EEG, what people call brain mapping, when we do that session, what we're looking for is, how is your brain functioning? And there, again, if you have slowing, coming up from the back of your neck to your head, and which shows up in the temporal regions, and it comes with symptoms. It can come with emotional symptoms, mood symptoms, memory symptoms, brain fog, brain fatigue.
And
so
not to mention diarrhea.
Well, again, you're talking central nervous system, and the brain is the hub of the central nervous system.
Right.
So yes, you can have other symptoms if they're related to the central nervous system. We will be able to see it and help it with neurofeedback.
And it's not just going away.
It's not going away. We work with functional doctors, and we have a protocol that we put people on that helps your blood not get thick and clotty. We, help heal the vascular system. There are diets that are helpful, anti-inflammatory diets, autoimmune diets that are helpful. So we try to look at it, again, holistically. If we look at your EEG and your symptoms, and we're like, this is long COVID, then we have a protocol. Includes light therapy, oxygen, which we have in our office. We are doing these things to try to heal you at the cellular level. And it's not just your brain, but yes, we focus on the brain and the central nervous system. And
neurofeedback would be part of that.
Yes, absolutely. Yeah, because neurofeedback, so we can increase blood flow and oxygen to the brain through neurofeedback and neurostimulation. We can increase ATP, which is the energy for the mitochondria, which are the powerhouses of every cell. And we can correct slowing. We can actually, turn back on the cognitive processing frequencies and reduce that vascular slowing by stimulating the brain. So yes, we can reverse.
The spike protein is still there, and it's being replicated.
We detox if we suspect. If your symptoms are continuing to get worse, we suspect that you still have spike protein, and we will send you with either our functional doctor or your own to do a detox protocol.
Okay, so you can be detoxed.
You can be detoxed, yes. Yeah,
Okay.
absolutely. hmm
So
And
if people are freaking out and they're listening to this, and I know people who
don't freak
would,
out.
you would basically say contact a neurofeedback person near you or Grey Matters. Make sure they do EEG analysis, brain mapping, right? Because that's
Yes.
kind of critical. And just relax. Go to that session
You
and
survive. You survived the deadly part.
okay,
Is what I would say. You,
okay.
like me, you survived it for a reason. You survived the deadly
hmm
part,
hmm
and now it's about regaining your full vitality,
Yeah.
and that is possible. Yes.
And I'm guessing insurance doesn't pay for much of this.
Not in Colorado, which is interesting because we
Mm,
have the governing board
mm.
here, but in other states, yes.
Oh,
Um,
okay.
Neurofeedback is covered, especially if you're in the Northeast, um,
Oh,
then yes. Or if your insurance, I've had a couple people whose insurance is out of Minnesota, and so their insurance will pay for neurofeedback
so it'd be
for the
worth
most
looking at.
part. Though.
All
Yeah,
right, give me a story of somebody that you can talk about that
sure.
had long COVID and their experience. What happened? What was the treatment? And are they noticing a difference?
Yeah, we'll see if I have time to talk about two. But so one of the cases that I'm presenting at the national conference is on her name is Sonia, and so she had very severe. She had the alpha variant, very severe symptoms. She actually had convulsions. She had tremors. She was a young woman in her early 30s,
Oh my.
and she had been searching for about 6 months before she found us. She had to leave her apartment, move back in with her family. She was on leave from her job because she could not work.
hmm
Um, she looked disheveled and kind of tearful, shaking, trembling. She came into our office and we, were able to do the EEG and get her started right away. So we did a lot of interventions with her. We did oxygen and light therapy and neurofeedback with her. I don't even think I had my STEM devices at the time, which actually speeds up our progress. But we just did traditional neurofeedback interventions with her, plus some supplements. And I think she did see our functional doc and kind of got on an anti-inflammatory diet. But
hmm
within about 6 weeks, and I present this case, so we have her symptom checklist. I
Yep.
mean, she was near suicidal because
Yeah.
her life was ruined in her view.
hmm
And within 6 weeks, she was sleeping,
hmm
which she had not been able to sleep more than about 3 or 4 hours at a time.
hmm
She all the convulsions had stopped, and she seemed like she was in her right mind. She was not dissociative,
hmm
which is a term for counselors, but she was having those issues too, and a lot of anxiety and depression. So within about 6 weeks, those got very mild. And then in the next 2 months, I mean, we probably worked with her for 4 or 5 months.
hmm
All of her symptoms went from 10 on a scale of 1 to 10, 10 being the most severe, to within 1, 2, or 3. And
Wow.
so when I'm presenting that case, I mean, I show not only her EEG normalizing,
hmm
but I show her symptoms normalizing too. So she basically, her testimony is, that she was given her life back,
hmm
and she was able to move out of her parents. She couldn't drive. I mean, her dad had to drive her, a 32-year-old woman. She couldn't function in her day-to-day life. So she was one of my most severes, and she was the alpha variant. Then I have a 22-year-old who was in graduate school and got the Delta variant, and he was sent to us from the Mayo Clinic, and he lives there and flew here and spent 2 months with us, and we did a lot of those same interventions, and so we put him on our system and sent him home with a home neurofeedback device, and and he would say, out of all of the doctors, because he's done hyperbaric oxygen, he's done Mayo Clinic, he's done the Amen Clinic, which also was helpful. but he would say that the neurofeedback that we did was the most helpful intervention in his year-long journey. And he's a 20-something-year-old kid. He's now he spent a month last month surfing in Hawaii. So he was so fatigued that he also had to quit graduate school and move back in with his folks. And now he's he's off surfing and doing 22-year-old activities. So we're thrilled about him as well. So those are, two different variants, but the severe variants and severe COVID. So I would say, yes, anybody who has long COVID symptoms will likely benefit from neurofeedback. And we can tell that when we take that brain map, when we take that initial EEG, we can tell if we can help you or not.
That's 26 million people in the U.S. alone.
Yes.
I mean, that's affecting the workforce,
yes,
relationship.
Yeah, so many people are on disability from long COVID.
Is that right?
It's staggering. Mm-hmm. Yeah, and cancers are up. I mean, there's so many.
It causes cancer?
Because of how it dysregulates the cell. Mm-hmm.
No immune system either.
And the immune system. Mm-hmm. So, when your immune system doesn't work, I mean, most of us I don't want to scare anybody. Most of us have a cancerous cell in our body at any given time. But
Thanks for sharing that.
Our immune system recognizes it and takes care of it. But if your immune system is so dysregulated from, this cytokine storm, this inflammatory problem from the spike protein, then it's not able to do its job.
So I think I know the answer, but I didn't want to ask the question. Long COVID you can't catch it from somebody, right?
No.
All right, it has to do with all right, so they're not.
It's down into that cellular level. You're no longer going to be testing with a high viral load. Most people, again, they test negative, a month before they go, why am I still not back to normal? Yeah. And like I said, I would say half of those people don't even connect it to their bout of COVID.
All right. Well, we have to end here. I want to give your URL. It's greymattersneurofeedback.com. So if anybody has a question, I bet you do. If not you know somebody, because it's 1 out of 5 who had COVID. Grey Matters, Grey, one word, greymattersneurofeedback.com, and you can talk to somebody on Shari's staff or one of the interns or her husband or Shari herself. And I wish you the best. So Shari, we do have to have another show on addiction. I'd forgotten about that. We had talked about it, and I want to do that because I'm talking a lot to addicts, and I think between the gospel and neurofeedback, I think we can help people who are really, really hurting right now, and it's not all their fault. So, all right. So that's it for this show. I want to thank Shari Johansson one more time, a dear friend, a colleague, co-conspirator in the gospel, and her husband, Dave. And I just want to thank her for her thoughts on long COVID, and I hope this has been helpful. So thank you, Shari, for coming on board.
Bill, I always enjoy our conversations, and so it's fun to record them.
We're changing the world, right?
Hopefully.
Hopefully. All right. Take heart, child of God.